You are one of a few certified canine veterinarian rehab specialists. You actually teach in veterinarians in colleges. I met you at Dr. Judy Morgan's, and you were doing um, a, a tuning fork therapy,
Yep.
which is super cool. And I think that's amazing. I can't wait to try that. And you sell those. So you teach people, you have courses online,
Yes.
and you are the AHVMA Holistic Practitioner Year Award for 2015. And you're in North Carolina. So welcome. Thank you for being with us today. I'm such a fan.
Thank you, Poppy. It's so great to be here.
So you wanted to talk about fascia, which I think fascia is absolutely fascinating. And I think that we didn't really know or value fascia for years. We just kind of thought it was the covering on meat and protection. Can you explain what fascia really is?
Absolutely. So fascia is one giant sheet. So it's totally all connected that covers everything.
It's one sheet.
It is one sheet. There's no like two things of fascia. Everything is connected. And it includes things like the meninges around the brain and the dura around the spinal cord and the pleura around the lungs and the this covering of every muscle, or it's around every nerve, it's around every blood vessel, it's around every lymph vessel, it's around every lymph node. It literally, they have electron microscopy that shows that it goes into that cell and it touches the nucleus of every cell in your body. And then you have bands of fascia so that if there's an injury or there's a overstretch, it contracts and it pulls, which is why you see some people that are walking like this,
Mhm.
right? Because their fascia on the inside, on the front of them is shortened. So it's uncomfortable for them to actually stretch it and be upright.
So
Or
it's
people,
drawing them into a cramping
yeah.
position. Dr. Laurie, bam, right off the bat. That is amazing. I didn't realize that it was one sheet and encompassed all these body parts. So tell us more. I'm just like jaw dropped.
All right, so there's two kinds of fascia, and they're all connected. There's soft fascia, which is what's around the vessels, right? So around lymph, nerve, blood vessels. It's if you get a turkey for Thanksgiving and you like, oh, I want to put herbs between the skin and the breast meat, and you put your hand in, you're in the soft fascia. That's what it feels like, that's what it looks like. And then you have firm fascia, which is around every tendon, every ligament, and it's hard and it's stiff. And that's what helps prevent cruciate injuries, right? Or around joint issues. It's that fascia that's helping hold things together. And the beautiful thing about it is we can strengthen that so there's less chance of injury. It around the spinal cord. In the dura, right? The dura itself is fascia, which that's what holds the CSF, the cerebral spinal fluid, that bathes the spinal cord to allow it to have nutrition, and then it comes out between each vertebrae so that it covers the nerves and comes around. So if you have it constricted and tight, it can compress the nerves, it can compress the blood vessels. If people have like swelling in their ankle, it can it can be the fascia around the lymph nodes and the vessels that's not allowing you to go back into the system, which then also you have the decreased blood vessels, so you have less circulation. So you may have your foot fall asleep, or you may feel numb, or it's uncomfortable. And you fix the fascia, and the circulation is better. The swelling goes away. You're more comfortable. It helps the health in so many ways.
It's so amazing. So it's almost like the body's mycelium.
Yes.
So it's just this huge, massive network that for so long we disregarded it.
Hmm.
Incredible.
Yeah.
So how do you fix fascia? I know in because I come from an equine background, they do this like blading
Hmm.
across the horse's body to loosen
Yeah.
up fascia. What do you do with dogs?
Everything. So, like, I've been through because I'm a constant learner, right? I've been through the Graston course, which is what you're probably talking about with the instruments.
Mhm.
I've gone through the equine course because they don't have a dog course. I've been through the human PESI, their rock tape tools, right? The instrument assisted for humans, so I could learn more about that so I can use that with dogs. And that works. And if you've done it, like when I went through the Graston course, it took me and a second person 3 hours to treat a horse. Right. Now,
Right.
the horse, I have a picture of the horse jumping afterwards. So this was a competitive jumper that came in and, heads down a little bit. And by the time we got done, she was relaxed. And her owner sent us a picture because we worked on this horse, of her jumping, and it's just beautiful. And you're like,
Amazing.
oh, I played this much of a part of making that horse do so well.
But it took 3 hours.
3 hours, right. So there's things that you can do. You can find trigger points and get rid of the trigger points. You can find the fascial planes that are tight and loosen them up. And then things along it um, break up. Can I show the picture? Are you okay if I
Yeah,
pull the
go
picture
ahead
up?
because that's so fascinating to me.
All right, so we are going to do this. So can you see the slide?
Yes.
All right, I'm going to do that. So I'm going to
And
make
you're lecturing at AHVMA.
I am. Um, I am I am lecturing at AHVMA. I'm home for 3 weeks, and then I lecture at Feed Reel,
Oh,
and then I
good.
go to from there to Colonial Vet Conference in Virginia. So San Diego, Virginia. Then I'm giving a 2-day seminar in Michigan to a vet hospital and their top clients. And then I'm home for 2 weeks and I fly to AVCA. I'm lecturing there where's that one? That's Missouri. And then the next weekend I am at, no, it's the Healing Oasis in Illinois, and then the next week in Missouri.
Wow.
It's crazy, but I love to teach.
That's so amazing. Congratulations.
Thank you. Yeah, so this is normal healthy fascia. So you can see my arrow, yes?
Yes.
Okay, so you can see there's lines of collagen and there's hyaluronic acid or hyaluronin, and fluid goes through there. So you can see if it was to get like this or like this, how fluid doesn't flow as well. And this is a great image because you can see how there's fat infiltration and what I call sticky, icky stuff that comes in and it just squeezes those poor little blood vessels. So you have less blood flow. And here you can see how it's thick and it's just not allowing fluid. There's actually studies that show that if you have people that have cancer, people, so this isn't rats, this is people that have cancer and they have fascial work done, and people who have cancer, same kind, so paired, who don't have fascial work, the people that have the fascial work actually have less metastasis. So
Wow.
less spreading. And
That
the
makes
only thing I can think of, and again, I'm not an oncologist, is that by allowing the fluid to go through and the lymph vessels to flow freely, we're allowing that immune system to take those nasty cells so they don't come down and start to grow in one place, right? Because the fluid's not moving and create metastasis.
oh my
And I
God.
think this
That
is
makes so much sense because flow, the body
right.
must flow. So,
Body must flow.
mhm.
And I love this image where, oh, where we go? Here we go. Where you can see the nerves, the blood vessels, and the fascia just when it gets sticky, icky, how it just crunches it up.
That's so insane.
Isn't it cool?
It is cool.
So
It's
cool.
really amazing. And a lot of us study animal iridology. And
Yeah.
so on the scirphorum, the outer part is technically skin. But now I'm wondering because we were all taught that when you have congestion in the skin, like allergies or the skin's largest organ, that you're going to get some bigger marks. But now I'm wondering if it's actually fascia that it's showing congestion in the fascia.
So not, I wouldn't do it in the eye, but you can tell if you have fascial restrictions with a tuning fork. So
Does it
it's,
change the audible sound?
no, it's by touching it. So if
Okay.
you take the tuning fork and I'm going to activate it, right? So it's vibrating. If you put it on somewhere that has no fascial restrictions and is well hydrated, right? So my hand, it just slides and glides.
Uh-huh.
Now, if I were to take that and put it, I'm going to do it over my thoracic duct. And let's see if you can see it. Can you see how it grabs? It doesn't
Yeah.
want to slide, right?
Yeah.
It
It's like just sticks in
Right. It's sticky icky. That's why I call it sticky icky. That says that there's fascial restrictions. So for me, I would want to clear that and then clear my lymph nodes to allow my lymph to flow better.
there. Okay. So how do you do that?
You literally activate it and you put it on and let it do its thing. So I don't know if you can see, but I have it perpendicular
Yes.
and that sends that energy in, that vibration. And this is very specific. It's 128 hertz and it's a really good tuning fork. So the tuning fork itself is super important. If you don't get one that's the right kind of metal, and I can't tell you what kind of alloy it is, but I know the company I get them from Tibet is they're amazing. And I've had people say, "Oh, that's why, I get this one on Etsy and it keeps falling apart."
Hmm.
You need a good tuning fork.
Don't do
Uh,
that. Yeah.
right. And you need one that's weighted because if you don't have the weights, like you were talking about, the energy is up here, right? So you use a non-weighted tuning fork if you're treating the biofield, and a weighted tuning fork that pushes the energy down into the tip. And then I take
What
it
is
one step.
what is that tip?
This one, let's see if I can put it up so you can see it better. Can you see how it's purple? That's amethyst.
And so you change your tips out or do they come pre-tipped?
So well, you can get them on my website.
Okay.
Right. You can get the different tips. You can get a free tuning fork if you take the tuning fork course. So because I never wanted to have anyone say, "Oh, Lori taught me this stuff, and I bought this cheap non-working tuning fork," and so obviously what Lori doesn't know what she's talking about, we send out, as long as you're in the US, a free good quality tuning fork with the amethyst tip because that's the best for soft tissue.
Okay.
So it's the right frequency with the right tip.
Now
Now,
somebody's asking on Facebook, are you going to Canada to teach?
I am not going to Canada to teach at this point. If you have somebody in the United States, we want you to have a good tuning fork, right? Super important. It cost me $50 to send a tuning fork, just to the mail,
That's
right?
ridiculous.
It's crazy to Canada. So if you have somebody in the US that you can put their address in, I am happy to send it to somebody in the US and then they can ship it to you.
Excellent. I love that hack.
Yep. Yeah, I mean, we have to have a workaround, right?
Yeah.
So this one I don't know if you can see, this one is lapis lazuli,
Okay.
right? This one is amazing for scar tissue. So if you think about any dog that's been spayed or neutered, it literally, oh my gosh, it literally melts the scar tissue away. My brother-in-law, who's actually in my house, which is why I'm not in my living room in my office, had due to I can never remember the name of it. It's not it's like Deuterin's disease where they get scar tissue in the tendons.
Okay.
And he was literally like this after like 6 months of physical therapy.
Wow.
And 4 days playing with the tuning fork, he has full extension of his hand. And you can't even feel where the scar tissue was in his tendons. And it was thick and raised. And the physical therapist was like, that's all I can do. They were
Amazing.
talking about injecting collagenase to break up the collagen, which is going to weaken the tendon, or doing surgery and scraping it, which is going to create more scar tissue.
How does it actually dissolve?
It's really cool. It's really cool. The reason I know so much about the lapis is because my own dog, Sid, who is my heart dog, had to have emergency abdominal surgery. We thought he ingested a foreign body. He didn't, thank God. But he had an incision where they had to go in and look. And I was traveling, I was teaching, and I came home one of my trips, and his incision was infected.
Oh,
And my dog, I'm a rehab vet, right? So he came to me with straight knees, straight shoulders, and a long back. And I'm like, I'm a rehab vet. You are not going to have a cruciate injury. You are not going to have a shoulder injury, and you're not going to have a psoas or back injury. So I work him. He works for every bit of food he gets, and he is amazingly strong. Like as in, you know what beg stand bag is? Where they're up in beg position and then they go up into a stand and they come back down.
He can do that.
He can do 60 to 80 in a row.
What?
Yeah. Yep.
Hey, okay. Like my dog's pathetic. So I have a rescue, a foster, and he is so swayed back. And he's only 2 years old.
Yeah, yeah, you don't want to do that. That's right. But
Yeah.
hold that thought for a minute. So
Okay.
my boy could not go from a bag to a stand at all because of this scar tissue. And I was frantic. And I grabbed my regular tuning fork and I'm like, okay, I'm going to use my amethyst tip. And it helped a little bit. And I'm like, oh my God, what can I do? What can I do? And I'm like, oh, wait, lapis. Lapis is for scar tissue. Literally in about 8 minutes, what was raised like half a centimeter was totally flat, and he was able to extend his back legs fully and be able to do them again. It was crazy.
So, Dr. Laurie, if I buy one of these, do your course in this sway back dog, he's better since he's been here. He gets exercise and he's gone from a kibble to a mostly raw diet. But
Uh-huh.
um, would I use the blue one, the lapis?
No, so when you have a sway back dog, it's not because the back is bad. It's going to lead to a bad back. What
It's
you need to do with him is exercise to strengthen his abdominal muscles.
the core strength.
Core strength. Yep. And we have the course, Core and More. And I will tell you, because you're right here and I can't not teach, right? The number one exercise you can do for him is when he's standing, you have to make it positive and you tickle his belly. And what he's going to, it's like goosing him. So you intention, he's going to do that. And that's going to contract his chest and abdominal muscles.
That
And
makes
then you
total
praise him,
sense.
you give him a cookie, or you give him a licky mat with a little bit of whatever makes him happy and then tickle him. Now, just like if I said, Poppy, I want you to do 50 sit-ups and you're not used to doing it, the next day you'd be like, oh my God, right? So you can't start with a lot, but you can start, 3 to 5, right? Maybe hold it up for 10 to 15 seconds and then build and build and build and build. The same way I didn't take sit and do beg, stand, beg, 60 of them. We started
Right.
with beg and then beg to stand and then begs to stand to beg and then build.
I cannot believe you can do 60 of those.
He's he is one of few dogs in the world that can walk on a round ball, like a blow up exercise ball, like
Seriously.
no support whatsoever. He can do it forwards, backwards, side to side, spin and twirl.
I
And
didn't
I
I
had
know that was a thing.
I had a border collie that could go on one of those balls because I did a ton of PT with my border collies running agility, and he didn't walk on the ball, like that's amazing, but he could stand on it, and I think I counted to like 10 seconds or something. He could balance himself without any support under the ball, but he was my only dog that could do that.
Well, and we just had Wendy Murdoch of Surefoot Pads as a guest. And so we were talking about the balance pads and the proprioception and the core strength, but that's like on steroids. That he can do it on a yoga ball.
yeah, yeah, yeah.
Insane.
Even my puppy, now she was a year in April. She's at the point where she has a peanut ball, right? Because again, you have to step up to it. And she can stand and hold it for 30 to 40 seconds. And she's starting to walk it sideways.
Yeah, I was gonna say that's super good lateral, right? Like because the peanut ball
Yeah.
goes, yeah, because I had a peanut and I had when I did all the agility stuff. Yeah, that's super good lateral.
Oh,
Yeah. So, Poppy, can I give you one more exercise? Because I can't not teach.
yes, please.
Do you have any exercise balls at home?
No, I don't.
Okay.
I have a yoga mat and that's kind of it.
Okay, that's okay. How big is your dog? Give me an idea on leg
Probably
length.
60. I think he's right here, but he's probably like 65 pounds.
Okay.
He's a pit bull cross.
Okay. So, I
And his
usually get,
elbows are ugly, doc. So
oh, this is
elbows,
perfect. Oh my God. Yep.
his elbows are like this way.
Yeah, yeah, yeah. So, the place that I get the balls the cheapest, so I would always check Amazon,
Okay.
is School Specialty.
Say it again.
Um, School Specialty.
Okay.
And they usually have them super cheap. And you don't want the you want the peanut balls that have the ribs on them. Gymnic, Gymnic, I think is the name of the company. They're amazing. I literally have had them for probably close to 20 years without popping.
Wow.
Whereas if you're like, oh, I'm gonna go to Walmart and buy an exercise ball, all it takes is one dog going and they're gone,
Yeah.
right? These are nice and thick. So for a 60 pound, 60 tall or 60 wide?
60 pounds. So he's he's medium height. It's kind of long, I think.
So I'm talking height wise. Is he like pitty, like I'm rough like a bulldog?
A
So
little
then,
bit.
so
The
then with the,
front half of him is, the back half is not.
okay,
He almost looks like a boxer cross on
okay,
posturing. So he can posture really pretty when he's like alert and engaged. But
uh-huh,
on his average, I mean, when he first came to me, he's been here 3 weeks. When he first came to me, I was like, oh my gosh, your back is like some old
yeah.
horse. Yeah.
So if you were to get a ball, you'd get a yellow peanut ball. That
Okay.
would be the right height for him.
Excellent.
And just having him stand on it and try to control it, that will help strengthen his elbows while his weight is shifted back. So
Okay.
it's strengthening everything in the front end without having excess weight on it, as well as his trunk.
Amazing. So you would actually not just have him put his front legs on it, but commit his whole body.
No, no. For
Just
him, I would just start with just his front legs.
that's what I was thinking. Okay,
Yep.
great. I'm glad we
This way,
clarified that. I'm like, I don't think he could do that.
no,
Yeah.
no, no. I want just his front legs on it. In the beginning, you're holding the ball.
So
Eventually,
when he gets up on the furniture, because I always let my dogs get up
yeah,
on
of
the furniture,
course.
he'll do that to himself. Is he'll put his front legs on there and then adjust his body all over the place. I'm like, look at you.
Yeah, he's smart.
Yeah, he's trying really hard.
That's cool.
Yeah.
And so then let's take one step further. So then his back hurts, right? Because he's lordotic. It's
Mm,
like the pregnant woman who has no abdominal muscle control because she just had a baby or she's very pregnant, and then she sway back and her back hurts. So you can use a tuning fork and go down on either side of his back,
okay.
not to get rid of the lordosis, but to help take away the pain. And then you take away the pain and you strengthen the chest and abdominal muscles, and he'll feel much better.
So can the tuning fork actually adjust?
It will get rid of the trigger points, and you've got two major fascial lines. So you have the deep dorsal line, which is right over the transverse processes in the ribs that comes up from the back feet all the way up to the head, and then connects and comes down on the superficial line, which is just under the skin. And those are two of the major fascial lines. So it will be working on that all the way down. And it's right over where all the bladder association acupuncture points are. So you're hitting those as well.
Excellent. That makes sense. So fascinating. Oh my gosh. How cool is this?
Can I teach you something that you can do with him right now if you find a trigger point?
Yeah,
Okay.
love
So,
to.
so all your listeners too, I want you to take your right hand or your left hand, it doesn't matter,
I'm
and
like,
come to the other shoulder and feel for a trigger point because most of us, we're on our computer, we're on our phone, we do this and we get trigger points in here.
yes.
You got it. Yep. So now what you're going to do is we're going to breathe together and you're going to put more pressure on the exhale. So put pressure on it till you can feel it. And then we're going to inhale and then exhale. Put more pressure on as you're exhaling.
It's
Then we're
grinding.
going to, then we're going to do it again. Ready? Inhale
Okay.
and exhale.
It's better already.
Yep. And now feel it again.
Yeah, it's softening.
So two physiologic ways, right? Because I play in like the energy field and I give me the science as well. So this is called ischemic compression. So ischemia is you're pushing the blood out, and then when you release, the blood comes back in and it affects the Golgi tendon organs. And you don't have to know the names of these, but it's a receptor that we know that will help get rid of that trigger point. On the other hand, as you're breathing, and I just learned this because I'm always learning, Andrew Huberman, who has a podcast that I absolutely adore, him and Peter Attia are like my heroes, and he'd had a podcast on the vagus nerve, and that when you hum or take big deep breaths and then long exhales, you're actually stimulating the vagus nerve, which goes up and stimulates, releases acetylcholine in the brain that helps you relax.
That's amazing. So how do we get our dogs to do this?
So you don't have to. You can do it for them for years, for decades. I learned that. Okay, do you want to play? Can I play with you, Poppy?
Of course. Let's
Okay,
play.
so I want you to stand up.
Oh, I'm in sweats.
I'm okay with that. All
Maybe
right.
that's a good thing. And I probably should like,
You're good. You're good. You're gonna turn sideways.
okay.
Yep. I want you to bend over and touch your toes, keeping your legs straight as far as you can go. Okay. Now, you're gonna stay down there,
Okay.
and then you're gonna do a big inhale, a big exhale, and then oh, I see your puppy there. After you exhale, I want you to reach further.
Okay.
Okay. So bend over, big inhale, big exhale, go down further. All right, come back up. Isn't that amazing?
Yeah, I went like 3 more inches.
Yes.
Yeah.
And if you're stretching your dog, you can do the big inhale and the big exhale, and then they stretch further.
So do they mimic that or just because, or do they like
I have no idea.
themselves? Because I know with horses, when I work on horses, I'll take a deep breath and they'll take a deep breath.
Mm-hmm.
Kind of just like, and so they'll do the same thing. But
It's not that. It's because it's immediate.
no.
Hi, sweetie. Oh my God, you're so cute. Hi, puppy, puppy. Hi, puppy,
He's like,
puppy.
yes, you need to do that, Poppy.
Okay.
He heard you talking.
He's so
Oh,
sweet.
there, he's
Oh,
doing
good
downward.
stretch. Yay.
Oh, you have a smart,
Good
intuitive
boy.
dog. Oh my God.
When did you get that baby?
I got him a couple weeks ago. He is
And
so
you're keeping it a secret?
he was at the same facility that my dog died at. And
Okay.
when the necropsy came back, the rescue pulled him and their other dogs that were being fostered by that thing. So I was like, well, I'll just take one of them. And nobody wants pit bulls or pitty crosses. So I was like, oh, it's fine. Bring him here. I have 5 acres. Like but he wants to chase all the animals. He wants to chase everything. Lizards, butterflies, dragonflies. So he'd never been in a country home. He was a homeless street dog in Stockton, and then he was kenneled for a year. So that's why his structure sucks.
Yeah.
Is setting in a kennel for a year. Like you can't do that
Right.
to animals.
Yep. Yep. And how amazing that you have him now. Are you keeping him?
I don't know. He's a lot of work. My cat's terrified. My horses. He barks at everything. But he's come a long way. So
Yeah, he's got to be exuberant, right? That's like the kid who's in the ghetto that comes out and he's like, wow, look at all this stuff. It's amazing. I've never seen that and I've never seen that. And look at that, right?
yeah, it's fun to watch him process. He'd never gone up and down stairs before. So he fell going upstairs and he fell going downstairs. I'm like, oh my gosh. He's like, every leg was in a different direction. I'm like, slow down, buddy. You got this.
Oh, Poppy. Poppy, we should talk about some things. I can give you some dog training stuff because I'm one of Susan Garrett's coaches online. You just call me one day. Yeah, you've given me so much information. Call me one day and I can help you. I'm not going to guarantee he won't chase ever again. That's really hard
He's a
to
pity.
yeah, that's hard. And he had to do it to survive, right? He was on the street. So, but I
Yeah.
can give you some things to do with him.
Okay. He's got to, if he's staying here, he has to respect the wildlife and all that. Yeah.
Yeah, that's hard on a farm. I totally get it.
Yes. But he's fun. I enjoy him and he's come a long way emotionally. So, yay.
But, and honestly, a tired puppy is a happy puppy,
That's how
right?
yeah.
You get him tired and he'll be like, "Oh yeah, look at that cow over there." Huh, okay.
We haven't gotten there yet.
Yeah.
I've tried.
Yep.
But
Yep.
hopefully we will. Every night and every morning he goes out into this grassy court and chases leaves.
Yeah.
Yeah. So it's been fun. So I can't wait to implement some of this stuff for him because you see his back's already quite a bit better, but just standing here, he's like right behind his scapula is just like
Mhm.
dropped off.
So also, are his nails long?
His nails aren't long, but his
Okay.
elbows really pop out both
Yeah.
four and like they're I thought maybe he had a bone disorder or something. Nobody's x-rayed him. So that would probably be my next move is to just see structurally what he's really dealing with because I don't think it's going to be pretty.
Yeah. Not for him, but for the rest of your listeners. Um, Literally, if a dog walks across the floor and you hear their nails, that's telling their brain that they're going uphill and it changes their posture and they're going to have lordosis or a sway back. And literally just trimming their nails immediately because that brain message is gone, they'll be less lordotic.
That's insane.
It's amazing, and I've seen it. The dog that it was demoed on for me was a pity that literally lost a third of its lordosis within 10 minutes of the 10 minutes it took us to do the nail trim.
Okay. Come here, Brody. Come here. Can you walk? So slight audible. It's not huge. It's not like a tap dance, but it is slight. So
Yeah, so what you can do, Poppy, is do your own research. Have him stand and have your camera at back level, right? Not from the top, and take a picture,
okay.
trim his nails, and then take a second picture.
Okay.
And you'll see if it changes his lordosis. Because if his nails are affected, if his nails are telling the message to his brain and that's causing him to change his posture, you can strengthen his belly all you want, but he's still going to have that message to his brain. If you take that message away, then as you strengthen his abdominal and trunk muscles, it's going to help him be able to hold it better.
Fantastic. These are so easy too.
Yeah.
How fun is that? So fascia. Let's get back to fascia.
Yes.
This is awesome. I can't wait to try all of this.
So, can I tell you how to find a trigger point in a dog?
Yes, please.
So, first of all, you want to know what normal feels like. So, if you've got a younger dog, they're soft and mushy and pliable and they're wonderful. They're like kids, right?
Yeah.
If you're starting with an older dog, it might be a little bit harder because you're not going to remember, you're not going to know what normal is. But if you think about going down their back, going like their hamstrings, the front of their legs, while they're non-weight bearing, and if you feel lumps in the muscle, right? Or you can slide down. Very common for dogs is the triceps. So coming down this right in front between their shoulder and their elbow, and you'll feel a bump. Another super common one is the gracilis. So that's on the inside of the thigh. And you can stretch them. And again, in the fascia course, we have all the stretches, so you can find all the trigger points. Um, in fact, we have a document. If your followers want, can I give you a phone number that they can text to, and
Yeah.
we'll send them a chart?
That'd be awesome. I'll
Okay.
put in the chat.
Yep.
Facebook chat.
Okay.
Go for
So
it.
it's 866-949-0068.
And this
If
is not some weird hotline.
no, 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 I
For a
promise.
good time. For a good time,
If
call Lori.
if you text the word fascia, so F all lower level, not capital, FASCIA. So FASCIA to the phone number 866-949-0068. We will send you, you send us your email address and we will send you the top 5 trigger point map of the dog.
Very
So you can
cool.
see where they are.
Awesome. Facebook hid that phone number. So you guys, if you
Okay.
wrote that phone number down and I have it on video, audio, we'll make sure the group gets it. And I'll
Awesome.
email it out to them too.
Perfect.
Oh, wait. Yay. And then
Yeah.
will we be on a text thread with your company?
No, no. What you're doing is we are just we have the you have to put your email address in and then we email you it's slick text, right? It's just
Yeah,
a way for us to be able to get things to people.
that's cool.
Yep.
That's fun. Excellent.
Yeah. Yeah, so that's the trigger point. So that's fascia, that's finding points, that's understanding fascia. There's so much about fascia. It's so cool. We talked a little bit about the instruments.
So it amazes me that it looks like it's so clean looking when it's healthy. How
Yes.
how often is it healthy and how often is it not healthy?
So again, the tuning fork actually will tell you, right? So one of the major things that you'll see is if you're dehydrated, it's sticky icky.
Okay.
And so the tuning fork is both a diagnostic tool, is it healthy, or and a therapeutic tool. So I can say, oh, here's another one. Can I show you another thing?
Yes. I almost fell off my chair.
It's-
Get fucked
So,
off.
so when people are stressed, there's an acupuncture point at the top of the head, right? So if you go to the front of your ears and you go straight up, it's very commonly right on midline. You might even feel a little depression. You can take the tuning fork. So this is GV20 for anyone who does acupressure.
Okay.
And if you put it up there and you have stress, the fascia around your cranium, around your skull, gets that sticky ickiness. And you put the tuning fork on, and it's instead of being like vibrating for like 30 or 40 seconds, it's like vibrate, vibrate, vibrate. Go.
And
And you can get rid of the stress by you just keep doing it until it gets rid of the fascial restrictions. It was at Dr. Judy Morgan, I met a man, I don't know, do you know Joe Flanagan?
I do know Joe.
Okay. So
Yeah.
Joe came up to me and he was talking like this and he was really stressed and we're talking about the tuning fork. And I'm like, okay. His neck was bothering him. I'm like, let me work on your neck, but let me just do your head for a minute. And like I put the tuning fork on him and it was like boom, boom, boom. And then I did his head. I let him listen to it because this turns on your parasympathetic nervous system. So you rest and digest and helps you calm down. And as I'm starting to work on his neck, we're talking to other people, and someone said, oh my God, do you hear yourself, Joe? And he's like, what do you mean? He's like, when you came in, you were talking like this and you were blah, 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 blah. And now you're talking like this. And he
Amazing.
was just so mellow. Yeah, I just saw him at Super Zoo. He's like, remember when you fixed my neck? And I was like, so stressed. And then I was like, so relaxed. So yeah, tuning fork can do that too, which
And
is
it's
so,
kind of a
Rob Silver too. I remember when you were
yeah,
doing him. It was like he melted. It was like you could actually see him melt standing there.
and
yeah,
that's so good for Rob.
yes.
Absolutely.
I
Yeah.
adore him. He's
He'll
he's
be.
just
Oh my God! I got to invite him too again. He missed my invite.
Um,
I knew there was
so
somebody.
when you do this on a dog and you're like detecting certain areas, is it like a permanent fix, or do you have to repeat it weekly or
Well,
daily?
that's a great question. So let's think about this. Sid had an infection that created scar tissue on his belly. I used a tuning fork and it got rid of it. Gone. Now, if Sid had torn his cruciate and he's painful, and so now he's walking like this, and now he's getting trigger points in his shoulder because
Oh,
he's
insane.
overusing his diagonal limb, I can get rid of it. But as long as he's doing this, it's going to come back, right? So it totally depends upon the cause and the chronicity. Sometimes you have things that are super, super chronic, meaning that it's been going on for a long time,
Like
like
that
the
or
scar
something.
tissue, right? He literally had to work on it, on and off for 4 days for it to go away.
Multiple times a day.
Yeah, yeah. He sat there. It was Christmas time. So we was hanging out and he would just work on his hand because he was in shock that it continued to get smaller and smaller and then his hands opened. So he just kept doing it until it's fine. And that was Christmas, right? And he's still good because he's here and he's like, look at this, it's still good.
That's so amazing. Now, surgeries. So
Yeah.
you talked about the stomach surgery, brain, if you have brain surgery, how does the fascia go back together? Does it ever grow back?
So you have scar tissue and then you have healing. And just like humans, as you age, because I teach on geriatrics as well, right? You have less growth factor, which helps things heal. And as you age, you have less receptors to catch that growth factor. So you have less healing coming in and less healing getting done. So it's slower, but it should heal, right? You get scar tissue and then think about it. Remember the old haystacks? Right? And everything was all mixed up. And now when people collect hay, it's all rolled up and tight.
Right.
So it goes from that haystack to nice and tight. It will never be most tissue never goes back to being 100% strong, and it just depends upon how much blood supply, right? So,
That's what I was wondering. And do you
yep.
encourage blood supply with PEMF or laser or
Oh,
any?
absolutely.
Okay.
I'm a huge multimodal person. Again, I've been lecturing on laser for 20 plus years and lecturing on PEMF. You know what an assisi loop is?
Yes.
I did the original clinical research when it was a Vivi and it was a human product. And they said, we're thinking about bringing it into the animal. So literally 5 or 6 owners ago of the company,
Yeah.
I did the original clinical research for them.
Amazing.
And they're like, we want you to put it on animals. And I said, absolutely not. I'll put it on my staff and my family so that they can verbalize. And then once we find out what it's good for, then we'll try it with animals. But I'm not going to use my patients as my guinea pigs.
Right. That's so nice. Uh, so the brain surgery aspect or any of these like shocking, traumatic, like I think it leaves a cellular shock to the organism. And so do you use like homeopathy or clays or anything? You do tape.
Oh,
How do
yeah.
you tape a dog with fur?
So I don't tape because I haven't had a lot of success with it. And
That's
when you
what I
look
was
at the
wondering.
research, you know, I see people putting tape on a long-haired dog. It's going to affect the hair follicle. But in humans, they shave hairy people, right? So
Yeah.
I get it, maybe horses, right? And I've been through the taping course for humans, um, but I did not in my hands find a lot of success with the tape.
Thank you for that because I've considered it. We've had tape experts on horses and people have said that they tape dogs, but it doesn't make sense to me because they're so furry. It just seems like it would just pull on their hair.
Right. So again, a dog like yours, which is super short hair, say they had a cruciate injury, right? Or surgery, and you want a tape to decrease the swelling and do the cross fibers, right? The thin strips across. In humans, it works great, right? You can watch the swelling. I've seen the ultrasounds where the tape literally lifts the skin up and allows fluid to go through to get rid of the fluid. but you take a German Shepherd and I would have a hard time. And before I forget, contraindications. When do you not use the tuning fork? Super, super important.
Thank you.
When something's broken.
Oh,
So in the olden days, when I was a kid, if you had like, hey, I tripped and I fell and I think I broke my foot, and they take an x-ray and they're like, oh, I don't know if it's broken or not. They would take a tuning fork and put it on there. Because if it's not broken, you'll be like, yeah, I feel it. And if it is broken, you'd be like, wah, right? Because what happens is the pieces vibrate separately, and it's very, very painful.
oh, it sounds awful.
I learned the hard way, right? Because that's how we learn best, one and done. When I fell and training my dogs, and I split my patella tendon on my knee. And I thought, oh, if there's inflammation, I'll put my tuning fork on it. And I was one of those that went, wah, amazingly painful, crazy painful. I'm like, huh, never do that to a dog.
Wow.
Yep.
Interesting.
Oh, and the other thing we have to say is we're increasing blood flow, so don't do it over a tumor, right?
Okay. So I was going to ask you about lipomas.
Yeah.
What do you think? Yes or no?
I wouldn't, right? Because I literally I did general practice for 6 years before I went into rehab. And I've had the lipoma that we sent in that had a mast cell tumor in it.
Right. A lot of them do.
I wouldn't do it. I don't care if it's a any kind of growth. We don't know what's under it, right? Or what's in it. And certainly if it hasn't been biopsied, it's not worth taking the chance. So if you want to, hey, he's got a lipoma on his chest and you want to do his leg, I have no problem with that. But not directly around or on top of a growth.
And what about like incontinence?
I just had a great, so not the tuning fork, but I just had a great conversation. We did a live with Deb Taraka. Do you know Deb?
No.
She's a PT from Wizard of Paws.
Oh, how
And
cute
she
is
did,
that?
yeah, right? She did a research project because she's a human PT who works with animals, and she's been doing rehab as long as I have. She's amazing. And where she took laser and she, on the underside of the dog, lasered the front of the bladder, the back of the bladder, and then over the lumbosacral area. So where the nerves come out that go to the bladder.
So the L4 area around.
So, well, lumbosacral. So L7 to S1 is what she did. And doing it, I would have to look at the live again. I think it was daily for like 2 weeks. 21 of the 22 dogs became continent again.
That is huge.
Yes.
21 out of 22.
Yep.
Poppy, you may know her. She works with nausea a lot, and she was at Kosher's events.
I don't, you know, I don't
I think
know.
she did a lot
Unless
of
you guys
Toka.
are like in my inner circle and stuff, I don't know a ton of people unless you've been a guest on my platform. Yeah,
Yeah.
there's a lot of
So-
You
you.
know more than you know.
But you know the nice
Yeah.
thing about dog people, I love this. They're like dogs. So they're just like so happy to see you and meet you and talk to you. Whereas horse people are like, who are you? I'm like, oh my gosh, I have to like fight to have you a guest on my platform because I have to be vetted as a verifiable source for them to be live on. But dog people are just like wagging their tail to be
We're
here.
happy, right? I love to teach, right? The more people, my mission in life is empowering people, optimizing pets, right? That is who I am. So for me, the more I can teach people, the more they can do, the more they can help pets, whether it be their own pet or if they're a professional, help other pets. Can I throw one more piece of information at you?
Yes, please.
Since we were talking about incontinence,
Yes.
standard process has for humans, and I've used it in dogs, simplex F for female and simplex M for male that help with incontinence as well, for urinary
Like
incontinence.
glandular therapy.
Yes.
Standard
Yep.
process is mostly glandular.
Yep.
Oh, what about stimulating other glands? Like you said, you could drain the lymph with this. What about the,
Oh yeah, for with the tuning fork?
yeah,
Amazing. Absolutely. So the reason I started studying about the tuning fork is because I went to an osteopathy class, and Patrice Corticus is a human osteopath from Finland.
nice.
And I went to her course, and I had broken my ankle, and my ankle was swollen. And I'm a rehab vet, right? So any vet will tell you that we always treat ourselves with everything we learn, right? We have to.
Yeah.
So my ankle's swollen and it's 3 months after the fracture. And I have lasered it, I've PEMFed it, I've had a CO2 machine on it, I have massaged it, I've done everything. And my PT, who's a really good PT, I vetted him a lot, said, Lori, it's going to take the average person a year to a year and a half for the swelling to go away.
That's
And I
awful.
went to this osteopathy, and right, I'm like, that is not acceptable for
Yeah,
me.
that's how I feel too. I'm like, that's a no.
Right. So I went to the osteopathy class, and Patrice was kind enough. She said, Lori, I'm going to use a tuning fork on you. And in 72 hours, 80% of the swelling will be gone. And 3 weeks later, the rest of it will be gone.
Wow.
And she was spot on.
That's so
Before I
interesting.
left, 80% of the swelling was gone, which was great because she could show the whole class. This is how it works. You clear the lymph, you clear the lymph nodes, and then allows the swelling to go away.
And it's just frequency and pressure.
It's using the tuning fork to clear the fascia that's constricting the lymph vessels.
So is it the electrical aspect of it that makes it so profound?
So the way in my brain it works, and I can't tell you for sure, is that you saw the pictures of the sticky, icky lymph
Yeah.
of the fascia, is that you've got all this nasty stuff on. We know what the what makes up fascia is these collagen strands. So in my head, you're vibrating that sticky, icky stuff off, so then fluid can flow and it releases
And fascia is primarily collagen and hyaluronic
acid. Yep,
acid.
yep. And then other you have fasciites, which make fascia. You have the cells that make the collagen, and then you have the tenocytes. And those three cells and the fibers and the hyaluron is what makes up all of fascia.
It's so crazy. So
And
does fascia make a real sound? Is
does
there an
fascia,
audible sound to fascia?
that I can't tell you. I don't.
So when when I was doing an equine dissection, um, and I saw the neurons, they
Hmm.
look like they would light up. The animal was
Yeah.
dead, so they don't. But the electricity, is there actually light that goes through the fascia?
I would guess so. So again, right, physics. I know that, so again, like I've done some of the research for the PEMF companies, right? And they have what they used to call it a Joey. I don't remember what they call it now, a detector for a PEMF signal.
Okay.
And it was so, so super sensitive that if you got three people close enough together,
Huh.
there's an electromagnetic signal. It would turn on,
Hmm.
right? And then we'd move apart and it would shut off, and then we'd move together and it would light up. So I think every human has some kind of, I don't want to say luminescence, but I think if you have the right detection, you can see things, right? Detection tools.
Yeah, I was shocked when I saw neurons because they were right there with the human eye. I did, all the anatomy books, you can read them till the cows come home, but you can't wrap your brain around it until you see it. And you're like, what? That's not what I thought it looked like. And so it was so
So
pretty.
can I tell you some cool stuff about that?
Yes, please.
So if you stub your toe, the nerve ending that is at your toe is the same nerve, one cell that goes all the way up to your spinal cord. It's that long.
No,
Yes,
but the same nerve, but it's not one cell. It's really one
one,
cell.
it's one cell.
That's
If
a
you,
really big cell.
yes, yes, exactly. And then you have interneurons, tiny little neurons, and the dorsal horn that can either turn up the volume or turn down the volume, and then it goes up to the spinal cord. And that going from that inner neuron to the brain is one cell.
I'm blown away.
And then take a muscle. So say you want to do like your triceps or your bicep, from origin to insertion
Right.
is one cell. A muscle fiber is one cell. Yep.
I've never heard this in my life.
Yep.
That's just mind-boggling.
It's so cool, right? Because we think of cells as something you can't see. And if you took that one cell, you wouldn't be able to see it this way. But if you turn it that way, right? Yeah, it has length to it.
So in my mind, just high school biology and college biology, you think it's comprised of so many different cells.
Well, you would think it would be like this, but it's
Yes,
not. It's like this. It's super thin, but it's like this, which is why, like, if you think of chicken breast or pulled pork or something like that,
ruins it for me.
sorry. I'm from the South. Well, I'm not from the South, but I live here now, right? And so pulled pork or pulled chicken is like super popular, and you're separating the cells.
I will never think of me again. Oh my gosh. That is incredible. Thank you. Wow. The things we don't know. It's
Yep. There's so much to learn. I love to learn.
and it's just ever evolving.
Yeah.
And it's so exciting to see where research and science is going because they didn't they didn't count fascia as anything but just covering up
Right?
the muscle for years.
Yep. Well, I graduated vet school in 92, so a very long time ago. And you think about what we learned then, there was no pain associated with anything other than a joint. And treatment was if you can't associate which joint it is, we used to call it R&R, rest and Rimadyl, right?
Oh, wow.
That's all it is. If I can't say it's a stifle or a hip or a hock or a toe, then it's just soft tissue. I don't know what it is. I'm not going to do anything. I'm just going to give him some kind of NSAID, some kind of drug, and rest him. Crate rest, all right, would never be allowed in human medicine. And that's all we had. And so, Poppy, I don't know if you know this. I had the first rehab clinic ever, designed the first underwater treadmill. So I literally fell down the stairs putting my dogs out at 3 in the morning.
What about you and all your accidents? They've turned into all these blessings for you. You're like, I did this.
Uh, okay, so you want a good laugh? So
Yeah.
I'm hiking. I am literally hiking. We have me and a good friend of mine, my dog, we're on top of a mountain. We've hiked, what, 2.5 miles.
I'm
It's a
scared to hear this.
mile and a half to the car. I fall and break my ankle. I can't put any weight on it. And my neighbor thinks I'm absolutely crazy because now she takes my dog and my pack, and I thank God I have my hiking sticks. So I'm literally going 6 inches down a mile and a half to the car to go to the hospital. And I keep saying, all right, God, what are you teaching me? Obviously, you didn't snap something for no reason. What am I going to learn from this? Because it is,
Yeah.
right?
Yeah.
This is how we learn.
Adversity is opportunity.
Yes.
So
Yep.
amazing. It's made you such a better physiotherapist, veterinarian, because of all, I mean, thank God I've never had all these mishaps like you have. I'm really glad. Thank you, God. Yeah. Amazing.
Yep. Yep.
So what do you think can harm the fascia that we don't like glyphosate or diet? Can all of that play into it? Does it have its own microbiome?
It does not, as far as I know, have its own microbiome. Diet, absolutely. Obesity or even overweight, absolutely. One of the biggest things that is so easy to change, exercise, right? Inactivity leads to stiffness, which leads to contracture and pain.
So
So
motion
exercise is so
flotation.
important.
So obesity, how does that affect fascia? Because I know when we cut into some of these horses, they weren't necessarily fat horses, but they were really fat on the inside. So they had this visceral, like one horse had like 3 inches of visceral fat around the heart.
Yep.
So is that areas of pain that the body packs fat into?
Let's turn it the other way.
Okay.
Fat is an organ.
Ooh,
So white fat, which is what you saw around the heart, or like between our skin and our abdomen, our arms, anywhere where you have white fat, that creates inflammatory mediators, meaning chemicals that are released into the body to create inflammation. When we study aging, the reason we age is because of inflammation. So the more we can do to control inflammation, the slower we age, the faster we heal, the better we feel, right? So just letting your dog get overweight, you are decreasing their life expectancy. So the Purina study showed that dogs that were kept lean versus pet weight lived an average of 2 years longer. And these are labs. These are split litters. So it was a really good study, right?
yeah.
The it wasn't even free feeding. It was just to keep them pet weight and then 25% less. So a lean dog, 2 years longer, way less arthritis, way less metabolic disease, happier, healthier, right? If we can just get people to move their dog, walk them, do exercises, um, feed them proper food and keep them lean, you have your pet for longer. And think about this is his lab. So it was 15% longer that they lived. So if it was a Chihuahua, that's 3 years longer that they'll live.
Right. And these are probably fully vaccinated, castrated dogs.
You would have to guess.
Yeah. So they had so many other marks against them, which is really
But both groups would have been the same, right? If they're both they would both be vaccinated, they would both be spayed or
probably
neutered.
flea and tick meds orally so they don't, because they're in a study.
Right,
Yeah. The contributing factors of everything.
right.
Amazing.
Yep.
Obesity sucks. I didn't think of fat as an organ. How do you
Yeah.
explain that, please?
So it's considered an organ because it releases chemicals. So white fat cells, and the bigger they get, the more chemicals they release. They release leptin, restin. There's a bunch of different chemicals that can be released that create inflammation everywhere in the body. So it's not just, oh, they're overweight, so there's more pressure on the joints. And that inflammation goes to the brain. It goes to the muscles. It goes to the heart.
The
It's
nerve.
everything. The
So when
nerve.
we cut into the sciatic nerve, there was fat layer in
Yeah.
the sciatic nerve. And is that normal or is that abnormal?
Uh, I don't know. That one,
Okay.
I'm not used to cutting into them.
Yeah, it's definitely been a learning experience for me because I didn't expect to see a normal sized horse with lots of fat all
Mhm.
over its body. And the horse was literally oily.
Yeah.
Yeah, so incredible. That's so fascinating. Do you guys want to ask questions? Do you want to open it for discussion? Anybody? Julie? Julie's gone.
No, Julie's here.
I knew it.
So I actually probably have to show you videos at the event. Gigi does these weird things ever since I got her. She used to do yoga where she pulls herself her front feet straight and her back legs she drags behind her like she's paralyzed. The first time I saw her, I freaked out. And she's just moving in circles because she's rubbing her belly, I think, and she loves doing it on concrete.
Yep.
Now we have reversed it. We do that, and then we go into downward dog, where we go up in the front, and then we scoop backwards with the hind leg, the front down and the back up.
Yep.
I don't know if that's trying to rub her chest. Her skin's a mess right now from Florida allergies. but she's like, loves this. She could do it for hours. She don't care if it's cutting her up or not. She sat the other day after I gave her a bath for 20 minutes on the rug, just going back and forth. Back. I could show you videos. It's a riot. But is that a leg thing too, or
It sounds like
probably
she's
just all
either
just itchy?
stretching or itchy or both.
It's yeah, it's wild. You have to see
Lori,
it.
this brings up a question for me is if she says she's itchy, if the itchiness, does that affect fascia?
So
Like
itchiness
maybe,
is inflammation,
okay,
right? So yeah, I mean, inflammation causes fascia to get sticky. And maybe it's the stickiness that's causing her to stretch. I don't know.
and could fascia congestion cause skin issues?
I mean, dehydration in itself can cause fascial issues.
Okay.
So I haven't, Julie, what I would say is have you talked to a herbalist? Because I can tell you Sid, depending upon what food he's on or what's growing outside, gets allergies. And I have two different herbal formulas, depending upon if he's a little bit damp or if he's a little more dry. And that
Yeah,
just
for sure.
controls everything.
You'll see her down in Florida. I mean, she got really bad when the summer started, but she had a cone of shame on for eye injury. She has
Uh-huh.
when I rescued her, she was the biggest hot mess of the world. She'd been abused, both back legs are bad. She was kicked in the hip. So if you touch her hip, sometimes she reacts. One eye is shot, the other eye is now shot. I mean, it's just she's a hot mess. She's a science project. So she had to have a cone of shame because she injured the eye and got an infection in it, and it cut all her fur on her neck, and she broke out, and her ear got infected because she's a Shih Tzu. Got that all cleared up, but then all the other itchies and the bug bite. It's the bug bites walking with all the ants in the grass and stuff down here. So she's got a lot of fur missing because she's been scratching or chewing, but we've got it under control. And yeah, one day it's a spot here and then she's fine. Next day it's a spot there and she's fine. And the scratch, it's just been a hot mess.
Mhm.
Andy's a little itchy. That's the little puppy you saw, but nothing like Gigi. Gigi's a hot mess again. You'll see them both.
Julie, I think you need a tuning fork on the head.
Thank you. Probably that's me. I mean, that's the New Yorker in me.
So Julie, when you have your tuning fork, because you've got little dogs, can I give you another piece of information? If you just try to put it on their head to help them to relax, it may be too much, right?
Mhm.
Going down their back is easy, but if you take it and you put your hand on their head
That makes
and
sense.
put the tuning fork on your hand,
Uh,
it uses it through your hand, and they are much more likely to relax rather than be like, "Oh, what are you touching me with?"
okay.
I love that. That makes
Yep.
total sense. And then Julie gets treated on top of that.
Yeah.
Yes.
She's right here.
I don't know if you saw in the chat. If you want, I can also, because I'm going to take the class, just have you ship me the fork if that's better for you. So,
Yeah. So can I make a recommendation?
yeah,
Um, when you're so Julie, do you feel energy at all?
all the time.
Excellent.
I do energy work. I'm Reiki master.
Perfect. So I don't want you to order the class until you get to AHVMA. One, because actually I was just talking to Christine today. We're going to do a show special, so it'll save you
Okay.
$20. And when you're there, the tuning forks are exactly the same, but the tips are they're all amethyst and they're all different. So we
Okay.
can put like 6 out and you can feel which is the
Yeah.
right one,
Okay.
the best one for you.
Perfect. I do a lot of work with crystals, so that's perfect.
Awesome. Yep. Yeah, we'll have all the crystals. We have 8 different, I mean, it comes with amethyst and then there's 7 others.
Oh,
So
good. You'll
I
have
have
that
people
too. Good.
feel energy and they'll say, okay, which one is the best one for ginger, right? Or which is the best one for ginger skin allergies, right? And then you feel it and literally your hand will be drawn to the best stone.
Perfect. 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 And our booth is near Jill's booth is near yours, and I'm with Jill, so
Perfect.
we're all good.
Excellent.
Jill, do you have a question or you're just waving because you're going to be right there?
I'm waving because I'll see everybody in a couple days.
Awesome.
Yes.
Oh, I'm
Hey,
so
Jill.
envious.
Bye, Lori.
I can't wait to see you.
Ditto. I know. It's like it's been too long. So, Julie, if you've got your crystals at home, why don't you bring them down so you and Lori can test them in the booth?
I have so many crystals. I'd have a whole suitcase for that.
Well, you don't have enough luggage for that.
Yeah.
I have one in the car though.
You need a
Yes.
minivan.
Yeah.
I'm telling you, I feel like I'm moving in. When you have two dogs and one's a puppy, it's Gigi was good.
But Julie,
Candy, I
they're
got
only this
gates
big.
and everything.
But they have a car full of stuff.
Yeah.
As long as I have a car, it's easy.
Well, thank Julie's generously coming down and working in the booth with me, which is great.
Awesome.
Yeah, so and Lori, I have 4 new product lines.
Oh, cool. I can't wait
It's
to
been
see them.
5 years since Greg and I added anything.
Awesome.
And one
Mhm.
of them is awesome.
What's that?
And one of them is awesome. The
Which one?
the Pet's Life.
Oh yeah, remember the old Pets Life products, you guys?
Oh, you talked to Bud, so you're going to carry a
Yes.
pet. Yep, I
Yep,
agree.
got
It is
it.
something that I keep on my nightstand, and twice a week I put it on Sid's teeth. He is 8 years old and he has zero tartar.
Okay.
Well, I have a little trick
What
for you.
is this, you guys?
Oh,
Pet's
Black
Life
Magic. One of you
it's an
guys explain it.
Black
it's an
magic.
enzyme toothpaste basically that you could put on the cats or dogs. There's salmon and there's peppermint,
Mhm.
and it's amazing for gingivitis, and everything else.
Plaque,
And
tartar, poppy, plaque, tartar, bad breath, and gum stuff.
Yep.
and
Where do we
Lori,
get it?
From
Lori,
me,
you're in the South.
from me.
Do you
I'm
have
a
deer
dist I
flies by you?
Jill, what's your last name? I don't know if I
I'll
know
give it to
we
you.
don't know each other. Nazamek. I own Katie's Pet Products. We're a distributor for really cool supplements.
Excellent.
We
Well,
only
we'll
have
have to
cool stuff.
chat.
Huh?
Let's talk later.
Yeah, we should.
Do you live in the South? Do you get deer flies that bite the hell
Oh,
out of you?
no, not really.
Okay, we get those in Florida, and then the mosquitoes. Well, deer flies. When I get bit by one, I
Oh
get
yeah,
a
they're
bug
horrible.
about that big, about that high, red. You can fry an egg on me, and it doesn't go away for a week. The itch is insane. I was using the Pet's Life one day, doing a demonstration years ago, and I said, "Well, let me just rub it on there." Went right away. So every time I
Really?
get a deer fly, I used to keep a bottle. The rep used to laugh at me. I'd be like, "I keep a bottle around for bug control. It takes care of all the itchies on the really bad bites."
Oh, very cool.
That's
So
fun.
Poppy with Adore Pet, Bud, who started the company, I've known him for like 20 years. He gave me a sample 20, probably close to 20 years ago. And I was flying from the conference I was lecturing at to my mom's and then home. So I spent a couple days, and my mom, of the older generation, had a Pomeranian. So you can imagine what we call little dog mouth,
Yeah.
right? And I said, Mom, I got the sample. I'm going to be back in a couple months. Take it, use it. I'll pick it up when I come back. Because she refused to go to the vet, right? That generation.
Yeah.
I come back in 3 months and I'm like, Mom, you went to the vet. I'm so excited. What did he say? All the tartar's gone. She's like, I didn't go to the vet. Of course I didn't go to the vet. I used that product you gave me.
That's
From that day
amazing.
on, I have been a huge believer in Bud and his project. It has neem oil in it.
I love neem.
Yeah.
Yeah.
And it
You
doesn't
use
just
oil
prevent,
orally?
it's a gel or a spray.
Okay.
And literally I use the gel because I think it sticks to the teeth better.
Okay.
And you want to do it away from food because if you do it with food, the saliva washes it off.
And half an hour, wait half an hour for water.
Yep.
Okay. So
Yeah.
let
Yes.
enzymes do their job.
Yeah. So
Yep.
so yeah, that's me. So I'm Poppy. I know we don't know each other, but you might know Katie's Bumpers, the old fire hose dog toys.
Okay.
I started that back 24 years ago and became a distributor for supplements. And I mean, these guys can tell you, but I mean, I only have really high-end cool shit. I don't have any junky stuff.
Well, that's fun. I can't wait to talk to you because
Yeah, we'll talk. We'll talk.
the holidays is coming. I'm sure everybody wants great, healthy dog toys on top of everything else you probably
Yes.
offer.
Yeah.
How do we get the teeth cleaning stuff?
Who's asking?
Charlene.
Charlene.
Hi,
Charlene.
Charlene. Just let's see. I can give you my phone number. and you can call me or you can email me. So phone is a desk
Hold
line,
on. Can you
not
put it
cell.
in? Can you put it in the chat for us?
Where's that?
You know what?
There's a
You
little
guys,
icon that has like 3 messages on my side. I don't know if
you
it'll,
guys
The
want to
little
reach out to Poppy and I'll give her
chat.
Jill's number?
Chat?
yes. Yeah. But also, Julie, give me your contact info too. And
Okay,
I didn't give
chat.
it to you yet. I'll give it to you.
Let's see.
I'm so excited about this teeth job.
It's cool
Oh,
stuff.
it's awesome. I don't like
Eh.
the spray as much because you have to get the mouth open, whatever. With the gel, you just go right in and they don't even know what hit them.
Yeah, and dogs who are sound sensitive, the spray, they're like, whoa, what are you doing?
That makes sense.
And Charlene, I leave on Thursday, early Thursday morning this week for the conference. Are you coming down to HVMA?
It's in Florida, Charlene.
No, but I will message you tonight to get it.
Great. Okay. Perfect.
Thank you, you guys. So fun. Yay.
Yeah, here we thought we were going to talk about fascia, right? So many different directions.
Well, we can talk about Miristin if you want, but that's another day.
Yeah, I would love to.
Actually, that's something she developed that's really good, Poppy.
You developed that? Excellent. Yay. Okay.
It's another person for you to talk to.
Absolutely. It's an
I'm always sending you people.
opportunity. It's totally, I haven't run out of anyone yet. So that's
And you
fun.
got to get me back on with Jackie now.
Yeah, that'll be fun. Laurie, any
Mhm.
parting words, or does anybody have any other questions? I'm just excited. Is there any discount for the tuning work course?
You know what? I can make one.
Yay.
Yay. What about if I did, I'll make it tonight. And how about if we make the code word Poppy
Sounds great.
and then give it $20 off? How's that?
Sounds good. Now, this is a evergreen where you just like go
Yep.
at your own pace and
Yep.
you get the tuning fork included.
Yes.
Oh my gosh.
Yep.
How cool is that? I got goosebumps on that.
Yeah, no, it's great and everybody loves it. And it's like I said, it's a high quality tuning fork, which is what's super, super important.
And if I remember, the class isn't that expensive.
No, it's $199. So with the coupon, it would be $179, and that includes me mailing. I don't even charge for the shipping because I want so many people to take it and use it. Yep, tuning fork is only available in the US, right? So, I just saw that in the chat. So if you're not in the US, then we can ship it to somebody in the US who can ship it to you. I'm happy to do that.
And Scott's asking on Facebook, what's the name of that gel again? Black Magic?
It's
No.
that's not the name of it, but
Adore
it is.
Pet. Oh no, yeah, Adore.
No, wait a second.
A-D-O-R-E.
It's the company name is Adore Pet, but it's not on my website yet.
Okay.
But my website is katie'spetproducts.com.
Okay.
And I put my phone number and my email address in the chat thing. So you can just get in touch with me, and then I've got, I can do a Poppy Phillips discount.
Okay. Sounds amazing. So Scott, we'll get you the info on that. And you guys, thank you for all the gifts. That's so fun.
Yeah, no, I want to help,
You want
right?
a gift from me?
Go ahead. It's like Christmas in September.
Now that I'm with Equisol Light Therapy, Lori, you probably met them at Dr. Judy's, and I'm working with them now, not the other company. I have 10% off your entire order anytime you order. And their light products you can get a nice, good sized red light mat for $270. And then they have the coat. Where's the coat? Gigi's coat. Anyway, they have a coat. You saw the dogs walking around at the show with them. They're awesome. I got that for Gigi. It has the neck, goes around the body, and it has a belly band.
So it looks stylish and effective.
Right. It's actually good. The Shih Tzus are going to work with her. It's a little much on the neck. Let me go grab this. I'm trying to think where I put it.
You guys.
We're going to work at the show. Work on a few things.
Here we go.
So while she goes and gets it, I looked in the chat and I'm like, oh, there's a whole bunch more here. So if I go from the back, Nancy said, I'm so excited to learn about the ways to use the fork. Thank you for the live chat.
Yeah.
Trisha said, I love the class and the fork. I need the other tips. Absolutely. It's very cool what they do.
So those tips you can like
Here we go.
cut them out.
Yep. There's a little screw that you use an Allen wrench that comes with it, and you just take it off and put the new one on.
Okay, cool.
So Lori,
Yes.
you can work on my white fat
Yeah.
this week.
We'll play. We'll play. I have a sign up sheet so that I can work on people.
Oh no, it's right here, Poppy.
The bat wings, the blind squirrel.
We're
Yeah.
just going to have a session at your booth, Jill.
Okay.
How's that?
Party at Jill's.
Right on. You guys,
That's why you have the
I'm
corner
so
booth.
envious right now. Now I'm like, oh, I just want to leave.
You can come, then you can babysit Candy for me.
Yeah.
Okay, I just put the 10% discount in there. And this is the coat. Wait, can you see me on the regular view? There we go. So I'll put my arm in there. So there's the neck. It's hard to tell with this. And then it goes around the body. If you go on the website, you'll see the pictures. It's really cool.
Okay, so will that fit a bulldog since they have a
Yeah.
massive neck?
They come in sizes from XXS all the way up to extra large. There is a horse one that she's going to do on a rental because it's too expensive, and a human one all coming out. We are changing the name of the company, so it's not Equisol anymore. It's going to be Animasol. And we've got, I was going to say, this, it runs big because the straps are pretty big and loose. We put Najda's bullies in. We put Tonka in a small, and we put Macy Trey, the little guy she has, if you know who that is, in an extra small. So, and they look so cute. All her dogs are just lying around in them. It's great.
And Dr. Laurie Scott saying that he was one of your first underwater clients, Scott Ludwig.
Wow. Holy cow. Cool.
That's
Thank
pretty amazing.
Oh, awesome. How cool to hear from you, Scott. That's amazing.
Silky Terrier Casey was one of the dogs at your facility.
Yeah, at Tops. That was a long, long time ago.
That's hard to believe. You look so
Before-
young. It must be that
When we all had brown
fluid
hair.
lack of visceral fat. No
It-
white fat.
Exercise and collagen. Let me
Yeah.
tell you, it's huge. And yeah, exercise is so important.
Do you feed your dogs collagen?
I do. So if you're talking about products, and again, I have nothing to do with this company. Great Lakes Collagen is a human product. It is ground up bovine trachea,
Okay.
and my whole family is on it. My in-laws are on it. My dogs are on it. My patients that have any kind of tendon or ligament issues or cartilage issues, I put them on it. There's other collagen products, and when you look at it, there'll be like 3 or 4 amino acids. This one has 19 of the 20 available amino acids.
Amazing.
Great Lakes, you said?
Great Lakes. Yep.
I take a lot of amino acids. I'm a big believer in amino acid therapy,
Yeah.
but I've never taken collagen. I've always been a little weirded out by it. So interesting.
Yep. Yep.
Trisha's
That's
like
cool.
shaking her head at me. Yeah, I've always been like, I don't know enough about collagen to like infuse my body full of collagen.
Well, I would never infuse, right? So I don't do Botox or anything like that. This is literally oral, and your body does with it what it needs. So it's not protein, right? So protein is a whole bunch of amino acids, but they're attached in different orders. This
Yeah.
is the individual amino acids, but it allows your body, like if you're worried about a cruciate tear, right? Let's give the body strength. Do the exercise, right? Because by exercising, you can increase the strength of the tendons and ligaments the same way as muscle. It just takes longer.
Okay. Excellent. Good
Yep.
to know. And Scott's asking, or I think it's Terry Ludwig, how much would you give a dog?
Depends upon the size. So if it's a Julie sized dog, it would probably be like a quarter teaspoon. And if it is a Mastiff, it could easily be a tablespoon, A
So
day.
a human requirement on a mastiff. Okay, you have your guess, and we should be respectful of your time. Thank you for hanging out with us.
And also for collagen, red light therapy builds collagen.
Right. Well, I do rose hips. So I
Nice.
eat a ton
Candy.
of rose hips, and it keeps the gels away.
There you go.
Yeah.
Oh, I need to do that then. And get my grandmother's
It
gels.
lifts it right up, you guys. It totally does.
Rose hips? Oh my God. Internally, not externally, right?
I eat rose hips every single day.
Very
It's
cool.
gonna be called rose cheeks.
Yeah.
Yeah.
Yeah, my hips don't look that rosy. That's right on, you guys. This has been great. Thank you, Laurie, for your time, and I'll let you get back to your guests.
All right. Awesome.
was
Thanks. Have a great evening,
See you
guys.
Friday,
Safe
5:30.
travels. See you Friday or Thursday,
See
Lori.
you,
you guys.
Joel.
Love to Mona.
Will do. Take care.
Okay, bye.
Bye-bye.
Bye.